Welcome to the Nose1a program conducted by Dr. Barry Craco, Medical Director of Maimonides Sleep Arts and Sciences in Albuquerque, New Mexico. This educational program will teach you about nasal breathing and the critical role it plays in sleeping well and all through the night. There are 6 sessions, each averaging 10 minutes in length. You will need about 1 hour to complete the sessions, but you will be able to pause and review material at any time while you are watching. At the end of the program, please click on the short survey to the right of the video frame, which will help you clarify the best treatment steps to improve your nasal breathing. Part 1. Normal nasal breathing. This lesson is 7 minutes. Dr. Craco will discuss the critical importance of nasal breathing in solving most sleep problems.
Welcome to the Nose1a program. We're going to try to tackle the problems of nasal breathing, how it relates to general health, and also more specifically here at our sleep center, helping you to sleep better. And we're going to go through 6 modules. The first one is called normal nasal breathing. What's so interesting about nasal breathing is that most people don't pay any attention to it. As many people often don't pay attention to breathing unless they have some reason to do so. You know, if you had asthma, you would pay attention to your breathing. But when I say that people don't pay attention, I'm referring to something very, very specific in terms of how well should a person breathe through their nose. And the answer is well enough that they would not breathe through their mouth. So as soon as you talk about mouth breathing, in general, you're talking about some abnormality. And yet, are you aware of the number of people that you see every day in your clinical environments, your professional environments, in your workplace, wherever you happen to be, that there are people who have their mouth open a lot? And they're mouth breathing. How many of them do you think know they're doing that? Most of them do not. Even when they have a dry mouth, a sore throat, they do not go to their doctor and say, I have to fix this problem because I'm mouth breathing and I've got a dry mouth all the time. And they have water with them all day long and they say, well, I'm just thirsty. And that's all they do. And that's the approach. But it's worse than that in terms of just the concept of congestion. Because when you think about normal nasal breathing, you should be able to breathe through both nostrils. You should be able to hear no noises except the flow of air. Just the flow of air. Nasal whistles, any kinds of congestion, any type of obstruction. All of these things mean there is something wrong with nasal breathing. Well, it turns out that most people who try to gauge this issue, how well can I, breathe through my nose, they don't gauge it. They don't pay attention to it. I see patients all the time who come in, they sit down, I say, what's your nasal congestion like? And they go, well, I don't really think it's a big deal. I use over-the-counter medicines once in a while. It's really not something that I spend a lot of time thinking about. I think it's just fine. I take one look in their nose, it's congested. But not only is it congested, it's red. And it's inflamed because they have been suffering from some kind of irritant for a period of time that has now produced what we call a normalizing effect on the symptom. So if you have a little bit of congestion, but you have it all the time, eventually you're going to say, this must be normal. This is my normal breathing. And of course, technically, the definition of normal, that's correct. You can say this is your normal breathing, but it's not normal. It's not normal. And what's remarkable to us is that even when we tell people that it's not normal, individuals are not standing back and saying, oh, okay, well, I want to do something about that, or I probably have to do something about it, or this is important. What I'm saying is think about the concept in psychology of the processes of denial. How do you end up having something that you do and you're not even aware of it? Let's say you've got a really bad temper. You're really angry. You're really frustrated all the time. You realize that people who have that problem, they don't get up every morning and say, oh, I'm going to control my temper. Many of them go for months or years of having this problem, but it never occurs to them that it's a problem. In fact, it never occurs to them that there's something out of the ordinary. Again, this is just who they are. This is just their normal way of doing things. So this is perhaps the greatest stumbling block or barrier when you're trying to help yourself when you want to fix the problem of nasal breathing, because you're going to imagine something that isn't truly normal. One of the closest things you can get to normal would be go into the shower, have a steam shower, clean out your nose, come out of the shower, breathe through your nose. Notice there's no nasal whistle, there's no congestion. It's easy to breathe through your nose and say, this is my goal. This is what I want to achieve all the time, all day long, especially before I go to bed, and especially when I wake up in the morning, which are very important indicators for assessing the issue. One other area that will lead us into our next module is that you'll have many individuals who have a little bit more awareness of the congestion. They'll say, I do blow my nose. I do take some medicine here and there. But most individuals will not say, I've treated it perfectly. They'll say, I think I've treated it good enough. And that, in our view, from a sleep medicine perspective, is an error. Because the only treatment outcome that you want is that there is no more problems with your nasal breathing. And that's how we're going to go through these steps today to help you appreciate what it is and what you can do.